You're not going to believe what caused this 15-year-old's foul-smelling nasal discharge. Welcome back to Your Health Explained. I'm Dr. Adam Goodcoff, and I'm warning you, today's case is a bit shocking. That brings us to our 15-year-old patient, who came to the ear, nose, and throat specialist after having foul-smelling discharge and actually some trouble smelling as well. The 15-year-old was otherwise healthy, well-appearing, with no birth defects to explain any kind of weird discharge. To make things even more complicated, he's never had any allergies or any sinusitis, which is an infection in the nose, before this. As with many things, doctors started with the most simple approach, that this could be some kind of an allergy. They started with an allergy spray and pill, but the patient had no relief. When the patient returned, despite putting a camera in the nose, nothing seemed abnormal except for this discharge. They figured this was some type of a sinusitis, a bacterial infection. This infection was described a little bit differently. In fact, as doctors, we smell nasty things all the time, but they went as far to say that every time the patient blew their nose, a foul smell filled the room. You can imagine how terrible that must have smelled. After over a year of on and off symptoms, doctors decided to get a CT scan to look at the sinuses themselves. What doctors would find on the scan was nothing short of shocking. Inside the scan, there was an approximately 1 centimeter mass. Unclear what this was, even after talking to the boy's parents, doctors decided to perform surgery to remove this mass from the sinuses. So it turns out on more history, and I will tell you what's in the nose, when the child was about 8 or 9, he was playing with BB guns and actually was shot in the nose. But at the time, he had no symptoms, they didn't think there was a BB in there, and he never had any problems with his nose after that, so they forgot about it. But during the surgery, doctors found a metal BB embedded in this patient's sinus. It had been in there for so long that tissue had actually grown over the top of the BB, making it very difficult to retrieve. The skin building up blocked the normal flow of mucus, meaning a high chance of infection for that nasty, foul-smelling pus. Can you imagine almost 8 years later finding this BB? A bizarre case to say the least. Now, before I tell you the last piece of this case, if you're enjoying this video, be sure to give it a thumbs up and subscribe for more medical stories like this. But back to our young patient. The surgery went off without a hitch, and they were able to repair the defect inside the nose and stop this nasty discharge from the patient's nose. So who would have thought a BB pellet in the nose could cause all that trouble years later? Again, if you enjoyed, click thumbs up, hit subscribe, and we'll see you in the next video.